Progressive sports medicine, we use a DEXA scanner to complete body composition scans. DEXA stands for dual energy X-ray absorptiometry, and it's considered to be the gold standard for measuring body composition, specifically lean muscle mass, fat mass, and bone mass. When we talk about fat mass, DEXA can differentiate between subcutaneous fat, which sits just underneath the skin, and visceral adipose tissue, which is the deeper, more metabolically active fat around the organs. It also gives us a detailed information about bone mineral content and bone mineral density. Now, there is some small radiation exposure with the DEXA scan, but it's very minimal, around 50 times less than what you'd receive on a 7-hour flight. The scan itself takes about 10 minutes, and we generate a report within minutes that we can discuss the results with you straight away. In the context of Medicine 3.0, the three key metrics that we're focusing on are visceral adipose tissue, lean muscle mass, and bone mass. So what do these actually mean? Visceral adipose tissue is the fat that sits deep within the abdominal cavity, surrounding organs like the liver, pancreas, and intestines. This is the type of fat that's strongly associated with metabolic dysregulation. Things like insulin resistance, fatigue, increased cardiovascular risk factors, and a higher likelihood of developing metabolic disease is seen. Research shows a clear relationship between higher levels of visceral adipose tissue and components of metabolic syndrome, such as a large waist circumference, hypertension, high triglycerides, low HDL, and fasting glucose. People with higher levels of visceral fat are much more likely to present with these risk factors. On our DEXA report, visceral adipose tissue is measured within the visceral cavity. We take a slice around the L4 to 5 region between the pelvis and the ribs, and then we provide different estimates or values of the visceral fat, such as measured in grams, the volume, and in surface area. Ideally, what we want to know is what's the initial number, with the goal being for it to be as low as possible, because lower visceral fat is associated with lower metabolic and cardiovascular disease risk. Importantly, high visceral fat isn't only seen in people who are overweight. For example, in this report from a 52-year-old female who is 160 centimeters tall and weighs 59.9 kilos, her visceral adipose tissue was 935 grams with a surface area of 195 centimeters, which places her in the high risk category. Despite having a normal BMI and a healthy body weight, she still had significant visceral fat and was experiencing fatigue and signs of metabolic dysregulation. This really highlights why DEXA is such a powerful tool. Someone can look healthy on the outside, but physiologically may still be at risk. This is exactly why we use the DEXA in the clinic, so that we can tailor exercise, nutrition, and lifestyle advice based on each individual's actual physiology and not just their appearance or their BMI. The second major metric that we look at is lean muscle mass. Now, there are two key things that we focus on here. Firstly, total lean muscle mass, and secondly is the appendicular skeletal muscle mass, which is then divided by your height squared, or often abbreviated as ASM over height. In this same report, her score is 5.1, which is extremely low. Anything below 5.5 for women is considered very low, indicating clinically significant low muscle mass or sarcopenia. In her case, she had both high visceral fat, very low muscle mass, despite having a normal BMI. So she presented in a healthy weight range, but had all of these physiological issues that we had to deal with. This meant that our recommendations for her were focused heavily on building muscle through structured strength training and to cease any GLP-1 medication use. Another useful part of the DEXA report breaks down the lean mass by region: left arm, left leg, right leg, and trunk. So this allows us to track where muscle is increasing or decreasing over time, which is particularly useful for someone who is completing a targeted rehabilitation program, performance program, muscle building program, or weight loss program. We typically would repeat these DEXA scans anywhere from 8 to 12 weeks, especially if someone's undertaking an intensive training or health program, so that we can objectively measure their progress. If we compare the previous case to another case, we might see someone with really high visceral fat, but quite good lean muscle mass. So this lady had an ASM over height squared score of 7.6, and a good score for females is anywhere from 7 to 9. In that case, our prescription might more be focused on reducing her visceral fat rather than strength training through higher intensity interval training or vigorous aerobic exercise. And our goal for her is more so to maintain her muscle mass versus to trying to increase her muscle mass significantly. We know that as we age, we naturally will lose muscle and strength through a process called anabolic resistance. This is why tracking muscle mass over time with a DEXA is so important. It allows us to see whether a training program is actually preserving or improving muscle mass, rather than just someone relying on their body weight or how someone feels as a good metric. Ultimately, in the clinic, our goal is to use gold standard testing to educate our patients, help them optimize their training, slow age-related muscle loss, and improve their long-term metabolic and cardiovascular health.
This content is provided for general educational purposes only. It is not medical advice, does not replace consultation with a patient's own doctor, and should not be used to make individual health decisions. Nothing in this presentation is intended to bypass or replace the role of general practitioners or established screening programs. No patient-doctor relationship is created by viewing this content. If a patient has symptoms or concerns or abnormal results, they should seek prompt assessment from their GP or treating specialist.